Hey guys, this is FixerMed. Welcome back to my high-yield hematology and oncology review series for the USMLE Step 1 NBME CBSE and NBME CS examinations. In this series, I will be covering the entire system of hematology and oncology in a comprehensive but high-yield manner. This will be part 16 of my multi-part video series of doing so. Today, we will be taking a look at autoimmune hemolytic anemia. Without any further delay, let's go ahead and get started on today's content. Today, I'd like to open up the presentation by covering an overview of autoimmune hemolytic anemia, also known as AIHA, both warm and cold AIHAs present with a positive Coombs test indicating antibodies against RBCs. A positive Coombs test means antibodies are present against RBCs, while a negative test means they are not. Alright, moving on. Alright, next topic. Warm autoimmune hemolytic anemia, AIHA, involves IgG antibodies against RBCs. Termed warm because RBC agglutination occurs at warmer temperatures. Example, agglutination when the nurse holds the blood tube by hand. Common in autoimmune diseases, examples of which include systemic lupus erythematosus (SLE) and rheumatoid arthritis (RA), chronic lymphocytic leukemia (CLL), or can be drug or infection induced. Alright, moving on. Alright, next topic, cold autoimmune hemolytic anemia, AIHA, involves IgM antibodies against RBCs. Termed cold because RBC agglutination occurs at cooler temperatures. Example, agglutination while blood tubes are transported to the lab. Common in infections such as Mycoplasma pneumonia and cytomegalovirus. CMV mononucleosis.
All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far.
A 35-year-old woman presents to the clinic with fatigue, pallor, and jaundice. Laboratory tests reveal a positive Coombs test. Further history reveals she has systemic lupus erythematosus. A peripheral blood smear shows spirocytes. Which of the following is the most likely diagnosis?
All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now.
The correct answer is a warm autoimmune hemolytic anemia. Warm autoimmune hemolytic anemia, AIHA, is most likely in this patient due to the positive Coombs test and her history of systemic lupus erythematosus (SLE), an autoimmune condition commonly associated with warm AIHA. The presence of spherocytes on the peripheral blood smear supports this diagnosis, as these are commonly seen in warm AIHA due to partial phagocytosis of antibody-coated red blood cells by macrophages.
All right, let's go ahead and see why the other answer choices are incorrect.
The incorrect choices can be explained as follows. E. Cold autoimmune hemolytic anemia is less likely because it typically involves IgM antibodies, agglutination at cooler temperatures, and is often associated with infections like Mycoplasma pneumonia or CMV mononucleosis. The clinical presentation and history in this patient point more towards warm AIHA. C. Iron deficiency anemia would typically present with microcytic hypochromic anemia and not with a positive Coombs test or spherocytes. D. Vitamin B12 deficiency would present with macrocytic anemia and neurological symptoms, neither of which are described in this patient's presentation. E. Hereditary spherocytosis also involves spherocytes on the blood smear, but it is a genetic condition that would likely present earlier in life and not be associated with a positive Coombs test.
All right, now that we have covered this question, let's move on to look at the next question.
A 52-year-old woman with a history of rheumatoid arthritis presents to the clinic with symptoms of fatigue, pallor, and jaundice. Laboratory tests show a positive Coombs test and the presence of spherocytes on a peripheral blood smear. Which of the following is the most likely diagnosis?
All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now.
The correct answer is C, warm autoimmune hemolytic anemia. Warm AIHA is characterized by the presence of IgG antibodies against red blood cells, which often occurs in association with autoimmune diseases such as rheumatoid arthritis. The positive Coombs test confirms the presence of antibodies against red blood cells, and the presence of spherocytes on the peripheral blood smear supports this diagnosis. The patient's symptoms of fatigue, pallor, and jaundice are consistent with hemolysis.
All right, let's go ahead and see why the other answer choices are incorrect.
The incorrect choices can be explained as follows. A cold autoimmune hemolytic anemia typically involves IgM antibodies and is associated with agglutination at cooler temperatures, often linked to infections like mycoplasma pneumonia. It does not fit the clinical context of this patient with rheumatoid arthritis. Bi-iron deficiency anemia usually presents with microcytic hypochromic anemia and is not associated with a positive Coombs test or spherocytes on the blood smear. D-thalassemia involves abnormalities in hemoglobin production leading to microcytic anemia. It would not present with a positive Coombs test or spherocytes, hereditary spherocytosis. A genetic condition causing spherocytes on the blood smear is not associated with a positive Coombs test and typically presents earlier in life with a family history of the condition.
All right, now that we have covered this question, let's move on to look at the next question.
A 40-year-old man presents to the clinic with complaints of fatigue, pallor, and dark urine upon exposure to cold weather. Laboratory tests show a positive Coombs test and agglutination of red blood cells when the blood sample is left at room temperature. The patient also reports a recent upper respiratory infection. Which of the following is the most likely diagnosis?
All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now.
The correct answer is C, cold autoimmune hemolytic anemia. Cold autoimmune hemolytic anemia, AIHA, is likely in this patient due to the positive Coombs test, agglutination of red blood cells at cooler temperatures, and the recent history of an upper respiratory infection. Cold AIHA typically involves IgM antibodies that cause hemolysis in cooler conditions, leading to symptoms such as fatigue, pallor, and dark urine when exposed to cold weather.
All right, let's go ahead and see why the other answer choices are incorrect.
The incorrect choices can be explained as follows. A warm autoimmune hemolytic anemia involves IgG antibodies and typically presents with agglutination at warmer temperatures, often in association with autoimmune diseases like rheumatoid arthritis or SLE. which is not indicated in this case. B. Iron deficiency anemia presents with microcytic hypochromic anemia and is not associated with a positive Coombs test or agglutination of red blood cells. D. Glucose 6-phosphate dehydrogenase G6PD deficiency typically presents with hemolysis triggered by certain medications, foods, or infections, but is not associated with a positive Coombs test or agglutination of red blood cells at cooler temperatures. E. Hereditary spherocytosis involves a genetic defect leading to spherocytes on the blood smear and usually presents earlier in life with a family history. It is not associated with a positive Coombs test or agglutination of red blood cells.
All right, guys, that is all I have for today. Be sure to leave a like if you found this video useful, a dislike if you did not find this video useful, and consider subscribing for more content like this in the future. If you would like to check out more review material, be sure to check out my other USMLE/NBME playlists on the channel. If you have any questions, comments, concerns, or suggestions you would like to make, please be sure to write them up and submit them in the comment section below. This is FixerMed signing off. Be sure to have a great day or great night, and as always, good luck studying.